So the last technique we're going to run through is something called a lumbosacral decompression. And this just really works on the fascia over the lumbar and the sacrum to try and relax it to allow as most comfort as you can. When we do go back to in-person teaching, or hopefully when we're able to get together again, there's a few other techniques we'll add in. But this is just another one that you can easily do on most of your patients who have any low back pain as well as your pregnant patients. And to do this, you are going to get a little bit more close and personal with your patients. You're going to bring your bottom hand between their legs to come in contact with their sacrum, and your top hand is going to slide under your back to come in contact with their lumbar. And we're going to put a little bit of a forward pressure and then try and distract that tissue. Now to think about that when you're doing it, you're not pushing so hard up that you're lifting them off the bed or coming in contact really with the muscles or the bones. You're going for fascia here. So just a little bit of pressure to come in contact with that fascia and engage the fascia. So a little more than you would be applying to skin, but less than if you were actually trying to palpate all the way down to that deep tissue. We're going to show you in her supine, and then I'll roll her over on her side so that you're able to see where my hand placement actually is. But to do this treatment for your pregnant patient, we're going to do it supine, just for comfort for them. At the very end, we'll also roll her over and have her prone, because this is the technique you'll use for most of your non-pregnant patients, is to do it prone as well. So what I'm going to have you do is just bend your knees both up. And I'm going to bring my arm through your legs to come in contact with your bum, okay? So go ahead and lift your bum up. I'm going to bring my hand through, come in contact, go ahead and relax down to where, again, my hand is cupping her sacrum at this moment. Now, my superior hand, or my cephalic hand, is going to come in on the side to come in contact with that tissue over the lumbar. So my hands are going to create a T on her back. And you can just relax for this. Now for this one, it's a passive thing, so your patient is actually laying. And so now once I'm in position and I'm applying that little bit of pressure, I'm going to pull my hands apart. So imagine trying to pull the tissue or the fascia over the lumbar from the sacrum. Does that feel okay?
Mm-hmm. It does.
And you are the weak link as far as how long can you hold this. It's as long as you're comfortable holding it. Now, when I normally do this, I have the bed kind of in an odd position for me, but normally I would sit next to the patient to help protect my own back. You can also do it sitting towards the end of the bed or standing. It's whatever's comfortable for you. So again, your patient will be supine for this, but just to show you where my hand position is, your hand would come through between her legs and come up and cradle the sacrum while your other hand sneaks across and goes across her lumbar. And then you push down with a little bit of pressure, or you'll be pulling at that moment, and then you pull them apart. And you just hold that as long as you can.